I welcome you to Reeby News. My name is AJ Royal. Today we are reporting at Karma Conference Center, which a press conference is being held here. It is being held because of illegal COVID-19 vaccine mandatory rollout in Ghana. So join us as we listen. Thank you.
I call upon Reverend Bright and Albright to give us the reason why we are here. Reverend, the podium.
Thank you. My name is Reverend Bright and Albright, the Director for the Coalition for Public Health and Justice, the President, the Vice President, leaders and members of the Coalition for Public Health and Justice, members of the Peace, Freedom and Justice Lovers, members of the diasporas, members of Advocate for Christ Ghana, concerned Ghanaian families, members of the Fourth Estate present, we specially welcome you all to our maiden press conference today. We are the Coalition for Public Health and Justice, and this coalition is made of medical doctors, scientists, lawyers, pastors, businessmen and women, and we have a definite purpose. Number one, to promote respect for health rights and justice for all persons in Ghana. Number two, to ensure strict adherence to sound public health regulations. Number three, to propagate credible scientific information about COVID-19 and other public health matters. And our purpose here today is to address the illegal COVID-19 mandate rollout in Ghana. We are also filing a lawsuit against the various state institutions that have made the vaccine mandatory in their respective institutions. Thank you.
Thank you very much, Reverend. So now that we know the reason why we are here, we have a couple of presentations that we'll be receiving from our key personalities who have been invited to be part of us. And the first to do the first presentation is Dr. Timothy Ama. He has been one of the key members championing this particular course of us right from day one. And he'll be doing us just honor to give a detailed information as to why we are saying illegal COVID-19 vaccine mandatory rollout in Ghana. Thank you very much.
Good afternoon to us all. Oh, I think in response. Good afternoon. So, as I've been introduced, my name is Dr. Timothy Ama, and I'm the Vice President of the Coalition for Public Health and Justice, and I'm the leader of the Concerned Ghanaian Doctors. I know the media house have been looking for us. Today I'm here. Hallelujah. Thank you so much. And I'm here to actually give us a summary of petitions that we have sent to the President of the nation and his response to us and our response to his response. So that is the purpose of my standing here, and later to answer any questions which may be posed to me. Thank you so much. So on the 10th of January 2022, we petitioned to the President to rescind vaccine mandates in public and private institutions across the nation. Over the past 2 years, the world has been embroiled over a fight against the COVID-19 pandemic, employing many measures, protocols, and tactics. This pandemic seems to have fostered an appearance of global unity and sense of community in an attempt to win this battle. Being a novel virus, many of these measures, protocols, and tactics have been at best educated guesses at fighting a virus of which we are still learning. Vaccines have been touted as our most recent and best tool at winning this war. However, we disagree with the strategy of banking all our hopes on these vaccines and directly or indirectly coercing Ghanaians to go for inoculations against this novel coronavirus disease, which, as previously stated, we are still learning about. We, as concerned Ghanaian doctors, we petition to the President requesting all forms of vaccine mandates across the country and requiring proof of vaccination with COVID-19 vaccines be rescinded with immediate effect and a pause in the vaccine rollout. We as physicians pledge to consecrate our lives to the service of humanity, practicing our profession with conscience and dignity, with the health of our patients our first consideration. Indeed, we are to uphold the principle of primum non nocere, which means first do no harm. As Ghanaians also, we pledged ourselves to the service of Ghana to boldly defend the cause of freedom and of rights, to cherish fearless honesty, resisting oppressors' rule. We cannot, in good conscience, stand by and watch the lives of innocent Ghanaians be gambled away and their basic freedom and rights of health abused. Before the rollout of any vaccine program, there are three major concerns that must be addressed, namely the necessity, the efficacy, and the safety of the vaccine. Looking at the available data and research concerning this pandemic and these novel vaccines, it is clear, at least to us, that these vaccines are not necessary, neither are they effective nor safe. On the point on necessity, as of the 5th of January 2022, there had been 148,079 total cases of COVID-19, with 13,576 active cases, 1,313 deaths associated with COVID-19, 45 severe, and 8 in a critical state. These numbers amount to an infection fatality rate of 0.89%, with 0.39% of active cases being severe or critical cases. At first glance, these numbers do not seem to adequately portray this pandemic, with quite a number of Ghanaians who trust in the media seeing this disease to be a death sentence. It is worth noting that the majority of deaths are in previously unhealthy individuals with multiple serious comorbidities above 65 years in a country like ours with a life expectancy of 64 years. Also, case fatality rate is probably much lower if you consider the fact that most people are not tested, both symptomatic and asymptomatic, which underestimates the denominator and probably exaggerates the case fatality rate. Seriously ill people and those who eventually die will most likely seek medical care in hospital and be tested. So the likelihood of people dying from COVID-19 outside the hospital is probably low. Also, significant effort is not being made to differentiate those who die with COVID-19, that is, those who die from other causes but tested positive for COVID-19 shortly before their death, from those who die from COVID-19, that is, those for whom COVID-19 is the primary cause of death. Making that distinction will probably reduce the number of COVID-19 deaths, reducing the infection fatality rate even further. A seroprevalence study from a town in Japan shows more people in the community actually have antibodies to the COVID-19, 396 to 855-fold more than the confirmed cases with the PCR testing. Although the quantitative reverse transcription polymerase chain reaction, that is what we call RT-PCR, has been described as the gold standard for diagnosing COVID-19, There are several difficulties involving its use. Concerns have been expressed about incorrect sample collection and processing, the cycle threshold at which a positive result is valid, and the relevance of a positive RT-PCR test with respect to how infectious a person is. Some of these challenges may contribute to the disparities in the test results seen from laboratory to laboratory all over the country. Acquired immunity after recovery from infection, commonly referred to as natural immunity, has been largely ignored and even in some circles treated as conspiracy theory. For decades in the history of immunology, full recovery from viral infections, provided one has an intact immune system without any comorbidity affecting immunity, confers some form of immunity against the disease caused by those viruses, almost always better than any vaccine. That knowledge seems to have been thrown away with the COVID-19. This truth is supported by an Israel study published in September 2021, which showed that individuals who recovered from the COVID-19, said they were 13 times more protected than individuals who have been fully vaccinated with a Pfizer vaccine 14 days after the second dose. In addition to the above, many cheap, freely available medications have been shown in many studies by physicians all over the world to mitigate the effect of COVID-19. Almost all of these pre-existing medications, which have been shown promising in initial studies, have been demonized and in some cases ignored for no substantive reason. Hydroxychloroquine, ivermectin, azithromycin, and others have always been known to be relatively safe. Some of these medications have been used for decades and are considered some of the safest medication in the history of mankind. Yet, almost all of a sudden, where COVID-19 is concerned, they have suddenly become dangerous medications. If there is safe, affordable, freely available early treatment for COVID-19, vaccines are no longer a priority. It doesn't take a genius to recognize the financial benefits of pharmaceutical companies in demonizing potential early effective treatment. If these medications do work, that's wonderful in humans' race fight against COVID-19. However, they are practically placebos. If they don't work, why the suppression and demonizing of these early treatments then, if the concern is health? Considering all this, wouldn't it be prudent to pause and ask ourselves whether these novel vaccines are necessary in the first place, especially where the young and healthy are concerned? It should be noted that we are an expansive population, with majority of our citizens young and vibrant. Now we move on to the issue of efficacy. During the early days of the pandemic, the general sentiment was to hold on for a vaccine to come and save the day. We were told that these vaccines were our only way out of this pandemic, providing immunity against infection, preventing severe or critical disease, hospitalizations, and death. Over time, however, all this have been shown to be false assertions. These vaccines do not prevent infections or spread. Recent studies show that the vaccinated are becoming more relevant in the spread of COVID-19. Many studies show outbreaks within fully vaccinated populations. Other studies show vaccinated populations as sources for outbreaks. And these studies, you can find them published by Lancet and other major institutions that is recognized worldwide. So this is not Dr. Tim saying something. This is something which is globally recognized. Over the last few months of 2021, the assertion that these COVID vaccines reduce the risk of hospitalization and death has been shown to be inaccurate as well. There are examples of this in other parts of the world. In the state of Vermont, USA, it has been shown that 79% of deaths in September 2021 were among fully vaccinated individuals. Over the month of September last year in the UK, approximately 79% of COVID deaths were among fully vaccinated individuals as well. And recent studies coming from Scotland, hospitals in Scotland, are showing that the rate of hospitalization of these fully vaccinated individuals is alarming, and the records are there. There are even schools of thought that theorize that the vaccinated are the main drivers of the pandemic. Are these vaccines really preventing transmission and spread? Many of the highly vaccinated countries are experiencing rising cases. In fact, 4 of the 5 most vaccinated countries are experiencing COVID-19 surges. Other studies also show that vaccination levels are unrelated, and I'm repeating it, are unrelated to COVID-19 rates. In other words, higher vaccination rates do not equal less cases and less death. Higher vaccination rates do not equal less cases and less deaths. And there are studies which have been done, which is confirming what I'm saying. Safety. Many safety issues have been raised all over the world with these new vaccines, most of which were developed under a year. With no reliable Ghanaian database of adverse events to COVID-19 vaccines, we had no option than to refer to foreign databases, namely the United States and WHO's databases. Individually as physicians, we have also personally seen many patients who develop known side effects of these vaccines within days to weeks of going for these jabs. Some of these include facial paralysis from Bell's palsy, infarctive strokes, thrombotic phenomenon, which we popularly call blood clots, pericarditis, myocarditis, visual disturbances, among others. However, from the database of the United States virus, it said there have been 20,622 deaths associated with COVID-19 vaccine as of 17 December 2021. The most recent available update, as at the writing of the letter we sent to the president, it showed a total of 1,017,001 reports of adverse events from all age groups following COVID-19 vaccines, including 21,382 deaths and 166,606 serious injuries between December 14, 2020 and December 31st, 2021. The American virus has been shown to capture only about 1% of all adverse events. WHO's VGSS reports 2,873,250 adverse reactions to COVID-19 vaccines as of 31st December 2021. The WHO VGSS shows that adverse drug reactions reported in connection to COVID-19 vaccines are about double all other adverse drug reactions of other drugs and vaccines combined, though these other drugs and vaccine predates COVID-19 vaccines by decades. So the meaning of the word VAS, you heard me saying VAS. VAS simply means vaccination, adverse events reporting system. Okay, so this is the reporting system they have in the United States. There have been reports of pericarditis, myocarditis, and other cardiac issues, especially among young men who have taken the vaccines. Although some may suggest that these adverse events are rare, they are still significant enough to the point where these vaccines cannot be in good conscience declared to be safe. Vaccine adverse reactions have also been over the years been shown to be grossly underreported. How feasible is a vaccination rollout plan, and what are the implications considering all the information presented above? As previously stated, recent studies cited above show that vaccination levels are not related to COVID-19 case numbers. In other words, higher vaccination rates do not equal less cases and less death. Countries like Israel and UK are typical examples of this. These countries have very high vaccination rates, currently deploying booster programs, yet they are struggling to get the virus under control, especially with these new variants. If we as a country are to vaccinate more than 50% of our population, are we going to continue with perpetual boosters every 3 to 6 months in an attempt to maintain vaccine-induced immunity for this disease? Where then is the end point? when these vaccines do not stop infection or the spread of COVID-19? Is this financially feasible for us as a nation? Again, as previously stated, contrary to the mainstream belief, some experts believe that vaccinated individuals may be the ones responsible for the emergence of this new, more infectious variant rather than the unvaccinated. A vaccine that generates antibodies against the original strain but does not prevent infection and spread selects for variants by allowing mutants which are not affected by vaccine generated antibodies to spread and become dominant. Viruses mutate, and we are going to continue to have mutants, especially with these vaccines, that are relatively ineffective at stopping spread of the virus. Perpetual vaccination with boosters is simply not a feasible strategy. Our recommendations: Ghana and Africa at large should be expected to lead the whole world in the fight against COVID-19. Why do we say this? All the relevant metrics show that Ghana and Africa at large have done better than most of the world with respect to the pandemic, even before the advent of these vaccines. It is possible the rest of the world are rather to learn from us. We may well be on our way to herd immunity if we are not there already. Per our cultural practices, it is not practical to expect Ghanaians to do away with social physical contact. Many Ghanaians have probably recovered from mild or asymptomatic disease and developed acquired immunity. A seroprevalence study in a lorry station in Accra, yet to be published, showed about 70% of the samples collected had antibodies to COVID-19, probably after recovery from the virus. Per the dietary advice that the president gave the whole nation during the early days of the pandemic, many Ghanaians may have strengthened their immune systems after eating more of our local dishes and fruits, which tend to be high in vitamins, minerals, and other micronutrients. Further research into locally made remedies and treatments for COVID-19 should at least be considered. The treatment guidelines that the Ghana Health Service put together for the treatment of COVID-19 is said seem to have really been effective, enabling most of the peripheral hospitals to treat COVID-19 positive cases, except those that may need ICU care. Other cheap and safe treatment options like ivermectin, fluvoxamine, and adjuncts like thiamine, methylprednisolone, etc. should also be looked into. So after presenting this petition to the president, he wrote back to us, and we want the honorable Ghanaians to also hear what our president wrote to we, the concerned Ghanaian doctors. So the office of the president, via the presidential advisor on health, responded to our initial petition on the 18th January 2022, outlining the following points. The president said there is no one. He said there is no, and I'm repeating, there is no current official mandate requiring mandatory vaccine rollouts within the country. 2, he said on the issue of necessity, there is clear evidence of public health impact of vaccination in terms of infections, hospitalizations, deaths prevented, and improved health outcomes that cannot simply be brushed aside. Providing data from a single management center, which is the Ghana Infectious Disease Center. 3, the president said on the issue of efficacy and safety, Ghana continues to boast of a robust and advanced monitoring process in ensuring safety in our medicines, vaccines, and other health products. Also stating that the most commonly reported adverse events following immunization are headaches, fever, pain at the injection sites, and body pains, which usually resolves within a day or 2. So receiving this response, we couldn't just keep silent about it. So we also wrote back to him. We acknowledged his response and we responded to his response. And I would brief the media on what he said to us. In acknowledging this response from the office of the president, we also took notice of a few things in the response and documented them in our written notes back to the office of the president, via the Presidential Advisor on Health. 1. Though it was stated that there is no official COVID-19 vaccine mandate, various government and private institutions have issued mandates to their employees and other stakeholders. Institutions like the Ghana Health Service, Ministry of Health, University of Ghana School of Medicine and Dentistry, Electricity Company of Ghana, Ghana Immigration Service, just to mention a few, have made it mandatory to show proof of vaccination before one can access their premises. 2. We also noticed that though statistics presented to us were meant to show that vaccines were effective at preventing severe disease, hospitalizations, and death, they rather show the opposite if you consider the context in which the data was obtained. For example, they stated that from 4th July 2021 to 14th January 2022, and the data was collected from the Ghana Infectious Disease Center. They said 10.1% of severe or critical cases were fully and partially vaccinated, and 89.9% were unvaccinated. What they failed to consider was that over most of that period, at least up to 4 December 2021, only 2.6% of the population were fully vaccinated, and 5.7% partially vaccinated, leaving 91.7% unvaccinated. Obviously, most of the cases would be unvaccinated, since the vast majority of the population was not vaccinated at the time of the data collection. The data that was provided did nothing to show any efficacy whatsoever of the vaccines. If anything, it hurt the case for the efficacy of these vaccines for preventing severe disease and death. Point number 3. The response to our initial petition did not address our concerns with safety issue and adverse events following immunization with the COVID-19 vaccines, as noted not only from our personal interaction with patients and others who have encountered life-altering and potentially fatal adverse events, but also from very reliable foreign and international databases. The response rather was to praise Ghana's advanced monitoring system and only acknowledging mild adverse events. No matter what Ghana's FDA database may say, we, as doctors, we are seeing real people experiencing real adverse events consistent with those stated in said foreign and international databases, referring to the US virus as well as the WHO's VGSS. Point number 4. The low case fatality rates, the strong immunity of the young and healthy, and the acquired immunity from natural infection also seems to be dismissed and not addressed in our response, or in their response. Point number 5. Though it was not challenged in the response, our statement of the fact that none of the COVID-19 vaccines effectively prevent infection or spread, it was totally ignored and seems not to be considered in by some of these institutions in their vaccine passport system and mandates. Vaccinated individuals are just as likely to spread COVID-19, just as the unvaccinated. There are even schools of thought of certain experts that believe that the vaccinated individuals spread the infection more than the unvaccinated. We stand resolute and sure that our desire to make the ordinary Ghanaian aware of the truth and the nuances of the happenings in our world today would help us collectively arrive at the best possible avenues for dealing with this pandemic and the attendant situations surrounding it. Thank you.
Thank you very much, Doc. I don't know what to say in addition to what the doctor said. Listen to him and getting some figures and facts from him. I don't know what to add more to what he just said. Now we've listened to a doctor. Now let's take the second presentation from a scientist in the person of Mr. Senanu. Edem Senanu.
Good afternoon, citizens of Ghana, brothers and sisters. I should remove my mask. Let me make a few preliminary comments that today you have a doctor, you have a scientist, you have lawyers. So we have doctors, we have scientists, we have lawyers. And beyond that, we have people who have been affected negatively going to speak to you. So let's set the context. We are not just here to be rabble rousers. We want you to leave here knowing that there is not just a scientific, a health or medical, a legal, but there are also people whose lives have been impacted in a way where we ought not to treat this lightly as a nation. And I think that that is very fundamental to why we are here today. So we are saying stop the illegal COVID-19 vaccine mandates. And I'll be speaking to that. 4 things I'll be talking about. I'll look at Ghana's current context. I'll speak to the WHO's position. I'll speak to some recommendations that WHO has made. I'll look at some more scientific data, also building on what Dr. Timothy Ama has shared. And I'll have some conclusions at the end, just to help us travel this distance together. And when you leave here, hopefully, when you are speaking about this, you'll be more knowledgeable than when you came in. So, a bit about Ghana. COVID-19 has changed dramatically since the first quarter of 2020 when we were all impacted. At the peak, there was a lockdown. We were stuck in our homes. You couldn't go out. From time to time, you got a few things. But come first quarter 2022, what countries are doing globally is totally different from what was happening under the lockdown. And so, for example, you have a situation in the UK where the issue of vaccine mandates has been lifted. The issue of testing has been reduced and minimized. And where for the first time, not just in the UK, but across the EU, they are considering the fact that previous COVID-19 infections provide up to about 13 months of immunity cover. And therefore, that kind of situation is even stronger than a double dose of some of the vaccines. Indeed, the data shows that you have a 71% effective coverage in comparison with the 67% when you've had 2 doses of vaccines. At this current point, many of the key countries are reviewing strategy. And one wonders why in Ghana, along with these countries who have suddenly done a U-turn. If you take the UK, they were expecting that in April 2022, they would go full stream, ensuring that everybody gets vaccination. But here we are in February, there's a U-turn. Vaccine mandates have been dropped. The issue of making sure that testing is done all the time has been dropped. And now there is a recognition that natural immunity gained from previous encounters with the COVID virus should now be considered in terms of your immunity to the disease. And therefore, that should allow you to go around the country doing legitimate business without being infringed upon, being obstructed, or being compelled to take a vaccination. Question is, what is Ghana doing? Why are we still in February 2022 insisting, forcing, and compelling citizens of our nation to have to take vaccinations, where the risks involved in these medical things have not been clearly established, and when Ghanaians are very concerned about that? So I'd like to start with that and say that there is a global context that ought to reflect in the strategy that Ghana has chosen. Now, let me talk a little bit about what WHO has said so far and use that as a bit of grounding why this discussion is so important. Now, the WHO has said that efforts should be made to demonstrate that the benefit and the safety of the vaccines are clear so that there's a greater acceptability amongst the citizenry. Now, although in Ghana, the GHS, Ministry of Health, have talked about some of the benefits, there's been almost no discussion about the risks, the safety issues. If you go to the website at the moment, the GHS, MOH website, there is no reporting on the risk, on the adverse reactions that Ghanaians have experienced. And for transparency and accountability to build confidence in citizens, that ought to have been the case, as is being done in the US or being done in the UK. What examples of people's bad experiences have we captured? And are we conveying to the citizens so that they know that, okay, these are the risks, but these are the benefits. You make your personal choice. And that is an ethical issue, which we are very concerned about. That ought to have been highlighted up to now. And the government of Ghana is not doing that. Again, they say that decisions about mandatory vaccination should be supported by the best available evidence. It should be supported by the best available evidence. How are we gathering the best available evidence globally to draw the conclusions that we have on this subject matter? So, if you consider that some of the health facilities have become very ruthless in insisting that public health doctors and practitioners must get vaccinated, otherwise you lose your job, and the other public sector and private sector institutions doing that, livelihoods are being affected when best practices are not being followed as far as the WHO has made us understand on this issue. And that is a major concern. Let me also state that in general, the WHO did not support mandated vaccination. What they said was that it was important that through education, citizens should be led to have an understanding of the issues and then voluntarily accept to be vaccinated. In other words, let them make the best choice based on the information available, because that is what the ethical considerations highlight. Unfortunately, that has not been the situation here. Whether at the airport, whether in the health sector, whether in schools, all of a sudden, without the consent of parents, children are being vaccinated. It raises serious concerns. Let me just pause and add the fact that in Ghana, for a mandate to be acceptable, for it to be legal, there ought to be an executive instrument. As of today, there is no executive instrument that has been executed by the Minister of Health, therefore making legal the mandatory insistence on vaccines. And that's a challenge. That's an absolute challenge. It means that our statement that these are illegal vaccinations is underscored by the current legal regime. I don't know whether our public sector officers understand what they are doing. And it's the reason why, as a coalition, we have proceeded to court. And I'm sure the lawyers will be speaking to where we are in that court process. Now, again, the WHO stated that vaccine mandates should be exercised with very due caution, except for a situation where all other feasible options have been considered and there is no other option. When there is no other option, the question is, is there a situation that we have no other option currently? Is there a situation that we have no other option currently? That's not the case. That's not the case. So, where lies the basis and justification for an insistence on compulsory vaccination or mandated vaccinations? There's no clarity on that, and we are quite surprised. The toolkit for tackling COVID-19 is constantly growing. And there are several antibody treatments. I mean, Dr. Timothy Ama has mentioned some. I want to add a few more, just to show that the options are so many that for anyone who's a scientist or a doctor, it doesn't make sense. Honestly, I'm wondering why I went to school. Because I can't get it. So let me just mention some more of the other treatments. Why it doesn't make sense we are insisting on vaccines. So we have Zevudi from GSK, recently approved by the UK. It has been found to reduce hospital admission and deaths by nearly 80% in high-risk adults. And they will also have the easily consumed molnupiravir and Pfizer's Paxlovid. These are oral antivirals, so you just swallow it. That's it. It's not a jab. Okay? And they have all been found and proven to have high safety and efficacy. There are other drugs that have been approved by the WHO, including baricitinib, a drug used in the treatment of rheumatoid arthritis, and sotrovimab, a monoclonal antibody. The availability of all these drugs make the decision of our government to make a vaccine situation mandatory makes it questionable. Especially when you are asking yourself, are these vaccines the only solution or the last resort? They are not. So I've just added about 5 more drugs that are available. So why do we have compulsory vaccines? Your guess is as good as mine. I think Tim has already alluded to Big Pharma and what's going on. Furthermore, recent evidence from the UK suggests that prior infection reduces the chance of infection and transmission to a degree similar to immunization, with benefits as much as 13 months. And this is according to the Office of National Statistics in the UK, compared with 2 vaccine doses that reduce the risk of testing positive by 67%. So you are comparing natural immunity that gives you 71% to 2 doses of vaccines that give you 67%. Which one is more effective? Natural immunity. Persons in favor of vaccine requirements have argued that it is necessary and proportionate to protect the vulnerable patients, and that is why they are doing it. However, the ability of the recent Omicron variant that evaded all the initial vaccines. So all the vaccines that we're using did not deal with it. And many of the drug companies had to go back to do work to find out. To the extent that asymptomatic health practitioners were also transferring and transmitting it. Tells you that vaccines by themselves cannot solve this problem. If you want to use vaccines in a situation where people are asymptomatic and where they are not stopping the transmission, it means that vaccines alone cannot solve this. At this point in the pandemic, given the fact that many countries are reconsidering their approach, given the fact that the target of 80% herd coverage across the globe, there is no single country, even those who have exceeded the 80%, have not yet achieved the so-called herd immunity. It means that the theory has not been supported by the evidence on the ground. I hope that makes sense.
Yes.
The arguments we have been told in the past that, keep vaccinating. Once you exceed 80% of the population, you will suddenly find that the numbers start coming down because you have achieved herd immunity, and therefore there will be a reducing number of people who are getting infected, and the whole situation will change. It's not happened. In Israel, in Ireland, in all the countries that have gone far ahead of us in doing vaccination. Rather, the countries, as Tim said, 4 of the top 5 countries where they have done more vaccination, where some of them have exceeded the 80%, they have seen spikes, surges, and more peaks. In other words, more people seem to be getting this in those countries. It means that the theory we've been talking about has not worked. It is time to reconsider the approach. According to the Ghana guidelines for emergency use of medical products, one of the reasons why emergency use approvals or authorization is given is in a situation where there is no adequate, approved, and available alternative to the products for diagnosing, preventing, or treating such serious life-threatening disease or conditions. Can I say that again? You are given emergency use approval for a vaccine. It is only done when there are no other options. Hello? So I'm even wondering why this approval was given when there are options. The condition for giving emergency use approval, and emergency use means that it should not become the default. It should be the exception to the rule. Let's get that right. What emergency use approval by our FDA means is that the use of the vaccines in Ghana should be the exception and not the rule. That's emergency use approval. And it also means that the approval itself ought to have been given only in a context where you do not have effective alternatives that can deal with the situation. After 2 years of scientists working hard to get on top of this issue, and where scientists across the globe have provided alternatives, one cannot understand why our experts and the so-called technical group meeting every 2 weeks advising government. Fortunately, our president seems to align with the citizens on this matter and say there's nothing mandatory. I mean, that tells us that at least there's hope for us. Why are other ministers and directors taking a position contrary to what the overwhelming scientific evidence shows, and contrary to what the laid down legal framework allows them to do? It doesn't make sense. Why are they holding on to old knowledge and not making any effort to stay abreast with current options? For example, I mentioned 5 already. Let me mention some more. Locally, we have dexamethasone and remdesivir, which are being used effectively to treat people with COVID-19. I've refused to mention the ivermectin, hydrochloroquine, erythromycin, because people want to argue against them. So let me mention 2 more. I've just said there are others. And this information, by the way, some of these are even on the applicable use article label. They are being used for human beings. Now, why isn't that education at the forefront of what our public health officers are saying? Why are we only going vaccine? Why are they not telling you, there are drugs you can take? It is for this reason that the WHO makes it very clear in its policy brief that individual liberties should not be challenged for longer than necessary, which is what they are doing to us. Our liberties and rights have been challenged. Policymakers are required by WHO standards to re-evaluate the situation of any form of mandate regularly, so that as soon as necessary, if a mandate becomes unnecessary, you remove it. What review is being done within the global context? Especially when we know that vaccines by themselves are not the panacea for the situation we find ourselves in. Let me move on to add the fact that people have genuine concerns, and you'll be hearing from some of the people who've been impacted negatively in a few minutes. Spoken to this already, so I'll move on to the next slide. People have genuine concerns about what happens to them when you inject them with these things. Is it right that if I have a concern, you should listen to my concern? Isn't it right? Is it right that if I feel like I don't want to take this for my own good, it should be taken on board? Is it right, especially when our national laws tell you that if I say I want you to test my natural immunization, my natural immunity, you should provide the facilities for me to be able to show that I'm naturally immunized? And when the state has not done that, why should I be compelled to take your option when I have an option? So, if vaccines who have been have been labeled as experimental, which have been labeled as emergency use, have suddenly become the norm around the globe, should all of us just follow them? It is a fact, and anyone can check, that at the moment there are over 1,000 scientific studies reporting on the adverse effects. And I've listed some of them there. Many of them. Tim mentioned some. Let me mention some more, just so that you know the risk you expose yourself to and the reason why Ghanaians and many citizens across the globe are concerned. Paralysis, menstrual abnormalities, blood clots, myocarditis, pericarditis. This one are heart things. Heart inflammation. We should have shown some of the video clips with the sports people who are collapsing on football parks, basketball fields, etc. Cardiomyopathy, vaccine-induced thrombotic cytopenia, autoimmunity resulting in death, cerebral hemorrhage, thromboembolism, and several unexplained deaths following vaccination. Isn't it interesting that Ghanaians are not being told anything about these unfortunate side effects? Is it also not curious that anybody who raises issues is immediately being told, keep quiet? It is in this context that we believe strongly that not only are the vaccine mandates illegal, and we are asking the president and his ministers to stop the promotion of these illegal vaccine mandates. We also believe that it is time that the technical team and all the advisors reevaluate the data. I side with Tim. The initial, and it's interesting. The coalition is from different splinter groups that had raised concerns from last year. And it's only in the last week or so that we got together. So I didn't know what he would talk about today. And he's taking some of the issues that I would have raised. But truly, and I want to highlight this, that as I listened to the doctors talking about the vaccines prevent more serious impact or adverse impact, the data they provided, straight to my mind, I was like, where was the big end? The population size. You know, in statistics, you need to be cautious how you do your percentages. And they kept talking about their facilities without realizing that the total population of Ghana ought to have been the base for the calculations. And there was no way the percentages were calling would be possible if we were considering the fact that 80 to 90% of Ghanaians had not been vaccinated at the time they were doing their calculations. So the data being provided at the moment by our health leaders, the way they have calculated the percentage is true. Ask them to go back and look at the statistics, perhaps get some professors to help them. It is in this context, therefore, we appeal to our president, His Excellency Nana Dankwa Akufo-Addo, to call his ministers and appointees to order, to do what is in the best interest of all citizens, not some citizens, not a majority of citizens, in the best interest of every single citizen of Ghana. That is the mandate we have given him and this government, because every life counts. Vaccinations may continue to the extent that citizens understand the risks they are exposed to. However, compulsory vaccinations should stop, and they should stop now. We call on the Minister of Health and the Director General of the Ghana Health Service, together with the Minister of Education and Director General of the Ghana Education Service, and all the other public institutions, Parliament, and what have you, I think there are about 13 of them, to withdraw the various directives mandating vaccination. We urge the government of Ghana and its technical team to consider and promote all the safer alternative options that are available. And not just that, they should regularly highlight these safer options, as well as provide information on all the adverse reactions that citizens have experienced in Ghana as a result of vaccinations. We, as a country, should not force. We should not compel. We should not insist. We should not, for whatever reason, drag citizens in public institutions and say, you will lose your job if you do not get vaccinated. This infringes on citizens' rights, our rights, to make personal informed medical choices as we deem fit. It will affect Ghanaians in the long run, and we believe that this does not promote the democracy and the democratic credentials of this nation. We thank you for your attention. God bless you, and God bless our homeland, Ghana.
Now we've listened to the first and second speakers. We are now going to listen to the third speaker, who is a lawyer in the person of Richard Nune Ben Beku. Sorry if I pronounced it wrong, please.
Good afternoon to everyone. I have been very concerned listening to the doctor and the scientists giving us the science and data about COVID-19 and the vaccine rollout in Ghana. But if you are here or listening to me and you are not concerned about the science and the data, there is one thing I want you to be concerned about, which is the illegality of the mandate that have been rolled out. We live in a country guided by the Constitution, which is the supreme law of this state. And that Constitution mandates certain performances by public officers particularly. So the president is not above the law. The minister is not above the law. No state institution, likewise, is above the law. So we will expect that whatever they do, be it a directive, be it a mandate, must be in compliance with the laws and regulation of this country. Because that is the only reason for which we exist as a country. And for us, as the Coalition for Public Health and Justice, our concerns are not only medical, our concerns are also legal. And those are some of the issues I'll be speaking to this afternoon. Now, first and foremost, we will appreciate that we live in a country governed by the 1992 Constitution. And we always say that as a country, we believe in the rule of law. And the basic meaning of rule of law is that you act in accordance with a certain law. So everything you do, you must point out to which law gives you the power to do so. And our concern basically is that the 1992 Constitution has guaranteed for all of us here and those listening to us from their various locations certain rights and freedoms. One of the basic rights and freedom guaranteed by the Constitution is found in Article 21, 1G, which is the freedom to the right to the freedom of movement. And if you look at the Constitution clearly, that right includes the right to move around freely within Ghana. So it implies that no one can restrict that right except within the context provided for by the Constitution. So therefore, where we have mandates that are requiring citizens and persons, be it employees or other stakeholders, engaging public or procuring the services of public institution to show proof of COVID-19 vaccine, otherwise they will not access the facilities, we think that such mandates are restrictive in their strict sense. You cannot run away from the fact. So if you tell me that if I do not show a COVID-19 vaccine card, I cannot come to school, what are you trying to tell me? You are telling me that I do not have a right to education, indirectly. If you are telling me that without a vaccine card, I cannot access parliament to meet my members of parliament that I have queued and voted for to represent me in parliament, you are telling me that I do not have a right to move freely. So for us, we are concerned about that. And we also recognize the fact that beyond these rights being provided for in the Constitution, the Constitution also enjoins persons in authority, including the legislature, the executive, and the judiciary, to at all times uphold the respect for these rights. So no one have an excuse not to respect the rights that have been guaranteed by the Constitution. However, these rights we know are not absolute. Why do we say these rights are not absolute? Because within the constitutional framework, you have provisions that provides for circumstances under which certain restrictions or limitations can be placed on the enjoyment of this right. So, for instance, if you go to that Article 21.4, a list of circumstances have been provided. And we all know that when COVID-19 broke out, Parliament of Ghana passed the Imposition of Restrictions Act, which the president has religiously in the past used to impose certain restrictions on our movement. So the lockdowns that were imposed in the past were on the basis of the exercise of president's power under the Impositions of Restrictions Act. However, there is a basic provision under that law, which mandates the president only that if the president so wishes to restrict the freedom enjoined by the Constitution, the president is supposed to issue an executive instrument in that respect. And as we stand here today, no executive instrument have been issued by the president in that respect. And the president, in his response to the concerned doctors, have also indicated clearly that he has not mandated any COVID-19 vaccine in Ghana. So the question we ask is, where do the persons and institutions that are mandating compulsory COVID-19 evidence getting their power from? Where are they getting it from? That is what should be of concern to all of us as citizens. Whether you believe in the science or you believe in the data, the lawlessness that is being paraded around today should be of concern to you. And that is why, as members of the Coalition for Public Health and Justice, we think that there is an opportunity for us to go to court for these institutions and persons to come and show us where they are getting their powers from. Because we do not live in a country without laws. We live in a country with rules and regulations, and we expect anyone who acts to act in accordance with those rules. Now, you remember the speakers before me were of the view that the minister can mandate compulsory vaccination. That is true. The Public Health Act gives the minister the power to mandate compulsory vaccination. But the minister can only do so when the minister passes or issues what we call the executive instrument. Now, there's something curious under that power. If you read the provisions of Section 22 of the Public Health Act at 851, you will come to the realization that certain persons have been exempted even if the minister issues an executive instrument mandating COVID-19 or any vaccination which should be compulsory. Persons who have natural immunity, and the speakers who spoke on science and the data have also shown you that the effectiveness of natural immunity is even higher than the COVID-19 vaccines that we've seen today. Persons who, for health reasons, cannot take the vaccine or any compulsory vaccination that should be mandated by the minister. But as we have it today, all these public institutions, the Ministry of Health, the University of Cape Coast, University of Technical University of Takrady Technical University, University of Science and Allied Health and Allied Sciences in Ho, are requiring students to show proof of COVID-19 vaccine before they attend lectures, including minors, without regard for whether they have immunity or whether they have health issues for which they cannot take those vaccines. And especially when the minister has not mandated any COVID-19 compulsory vaccination in this country. So we are of the view that that is unreasonable, that is unlawful. There is no legal justification for any of the directives being issued, whether it's even from the Speaker of Parliament. That is even worse, because the Speaker has no such powers to mandate such vaccination. And if you look carefully at the regulatory regime for medicinal products in Ghana, we all know that the Food and Drugs Authority is a body mandated to regulate the licensing and approval of medicines in this country. And if you look at the guidelines that was issued by the Food and Drugs Authority, under which these COVID vaccines are being rolled out in Ghana, which is the Emergency Use Authorization Guideline, you'll be shocked to note that that guideline clearly provides that where a medicine has been given an emergency use authorization, it implies two things, critical two things. One is that the consequences or the health risk associated with that medicine is unknown. So what we are taking today in Ghana as COVID vaccines have unknown health risk. Two, when such authorization is given, persons who are supposed to take those vaccines are supposed to be given enough information to be able to make personal decisions. Very important. Personal decisions, whether or not on the basis of the information they have to take the vaccines or not. So by the FDA guideline, you cannot compel anybody to take the current vaccines we have in Ghana. By the mandates that have been issued, you are compulsorily forced to go and take the vaccine. So are we respecting our own guidelines? We are not. The guidelines that we have in place for the interest of all of us, for public health and safety, to ensure that medicine and medical products that are administered in this country follow a certain protocol to ensure that we don't put the population at risk, is being abused. Persons are now being forced to take the vaccine without the options they have under the FDA guidelines. and we think that that must stop. That is without legal basis. That disregard for public policy and laws is becoming too much. And we will ensure by our court processes that all these institutions are ordered by the court to stop this mandate. Now, interestingly, the doctor and the scientists have spoken extensively about the safety and the efficacy of the vaccine. There is something I want to add further. If you look at the contraindication report that is issued by the CDC of the US, you realize that these vaccines have serious health implications for those who have taken it or those who are being forced to take it. It is not one that we should encourage our citizens to take without the opportunity given them to exercise their personal decisions. Our policy or our agenda is not to discourage the taking of the vaccines. Our agenda and our goal is simple. We have individual rights. Those rights are guaranteed. Let us exercise those rights within the framework of law as provided for in Ghana. No one should be compelled, either by a directive or by a policy mandate, to take the vaccine, given the generality of the laws that exist, that we have said that the institutions and persons that are mandating these compulsory vaccinations do not have any power. Do not have any power. It's only the president and the minister. And even that, there are contexts within which they can exercise those powers. So you ask yourself, where is the vice chancellor, for instance, or the registrar of UCC getting that power from? Where is the director general of the Ghana Broadcasting Corporation that have said that if employees do not show cards of COVID-19, they can't come to work? Where does he get that power from? What are we creating? Are we creating institutions governed by rules of men, or we are going to create institutions governed by the rules that we've all agreed to govern us? So those are the legal concerns that we have. And we think that it is incumbent on all of us as media men and citizens to join this campaign. Because if, like I said, the science doesn't matter to you, the freedoms we have should matter to you. This is a country that is governed by laws. The 1992 Constitution remains supreme. And then we expect that everyone who acts must act in strict accordance with those provisions. Thank you very much.
Hello. All right. We have some people who have traveled to come and share, but they are very concerned because it's a very emotional issue for them. So please, let's accord them as much sensitivity as we can. Is that okay? Can you stand? She says she'll try. She says she'll try. Please.
But I family doctors. Immediately, Naminim. But Naminim, Minyam. The first one nearby, and I'm the Kanko. The me worry and be 2 weeks. And I said, me, me, Pasabasa. Me call hospital, no. Doctor Cass said, Menyam. Na mama me koye lab nem scan. Na mama me no. Na amusi me nko no. Ti me koye no, asa still na me hunyem yie ba me nim say ma wo be trenti bia ni sena na. Ama me ho ne ya me sa. Ti me san ko hospital ho na doctor ka che me say o change enwe na mama. Ti me nko 2 weeks me nsamra. 82 weeks no so nice mo fie nice me yam no me style bi nice makuma no contentem ti na fifra started me iti me tina se na ma sorry na ma no msuo asa mo yamba sabasa na me hu de me nya me ho by manka minim say minsen na iti adechia na mko hospital na doctor no ma dru bi say 2 weeks nsamra. The 2 weeks we require no bisa me say nyinsen no a free ho. Then I'm say there be say me buy one can me say nyinsen no problem ho no say ɛne ɛkɔtwa scan nti mekɔtwa scan no mesan baeɛ na obisa me sɛ mewɔ mma no bi wɔ hɔ na mese a mewɔ bi wɔ hɔ ɛna ɔse mewɔ bi wɔ hɔ deɛ a ɛneɛ wei no deɛ asɛe nti ma yɛnyɛ me DNC na yɛnyi nti ɔyɛ na meka sɛ daabi sɛ mebaa last yi no wanka nkyerɛ me sɛ problem wɔ ho wo maame kɔtwaa biribiara na ɛyɛ dɛn na afe deɛ wɔka sɛ na ɔse ɔnyam a ɛsɛ sɛ akwaraa no da nsuo bi mu na ɔdanedane ho baa me deɛ no nsuo no nyinaa we afiri ho nti wie bi no akɔtare ma wɔdeɛ no ho nti sɛ yɛanyi a menya problem nti menkɔfa sika mmra nti wɔkaa saa no na mefrɛ me kunu na me kunu kaa sɛ ne menkɔ different hospital bi a na wɔboa adeɛ no bɛtumi ayɛ yie nti mekɔ baabi foforɔ no na ɔmo nso kɔtwa scan nam sɛ still adeɛ no nsuo biara nni ho nti ɛtare ma wɔdeɛ no nti sɛ still DNC no a na yɛyɛ nti DNC no yɛyɛ no Monday nti doctor no ka kyerɛ me sɛ ɔnwɔ me paneɛ ɔbɛyɛ because ɛyɛ just ayi na msi yo nti yɛstarteeɛ ɔtwe adeɛ no na asan kɔ nti wɔyɛ biara afei de doctor no sɛ wɔayɛ DNC a yɛayɛ baa sɛ me deɛ no ɛden ɔtwe adeɛ no a ɛnyɛ yie because biribiara firi ho ama no ayɛ tentan nti oyi a ɛmma nti wɔtrae biara na wohwɛ a wɔyi bi na ebisa kae na ɔmaa maduro bi sɛ menkɔnom na deɛ aka no nyinaa bɛba nti mekɔɔyɛ no Friday still na sɛ meyɛforo no ɛyie dede bi nti mesan ka na doctor sɛ bi sɛ ɛsan yɛ me biem nti that time no obisa me sɛ mawɔ paneɛ no bi na mesɛ madi kan kɔwɔ bi na menim sɛ manyam wanka hwee na ɔsɛ ɛneɛ bi sɛ ɛsan yɛ me another DNC ɛna ɔmo yɛ me foforɔ ɛna ɔmo yii adeɛ no nyinaa ɛfiri mu saa na mede ɛbaeɛ baako nso a ɛsan ka ho no na yɛ me kunu ɔno ɔka kyerɛ me sɛ ne ho yɛ no basabasa ɛna mede ne kɔɔ 37 nti yɛkɔɔ 37 no na ɔmo yɛɛ no labs bebree ɔmo nhu ade koraa ɛha no nti yɛkɔyɛ wei ne akɔyɛ wei yɛkɔyɛ wei ne akɔyɛ wei 2 days ɛna ɔno wɔfiri mu nti wɔfiri mu no na wawɔ bi ɛnso ɔmo anhyɛ dɛ nhu ade korɔ paa nti mekɔgye ayi no death certificate na ɔmo sɛ ɛyɛ COVID na wanya nti na wɔwu nti me kunu no wuiɛ no na nipa a ɔno nso bɛhyɛ me kunu anan wɔ adwuma no mu no na ɔnwɔ obi nti yɛne na ɛyɛ ayie no yɛ biribiara na yɛde no hyɛɛ me kunu anan wɔ adwuma mu hɔ nti Monday na ɔkɔwɔ paneɛ no bi nti Monday no mene ne kasaeɛ na ɔsɛ ɔwɔ paneɛ no wieɛ no ne ho yɛ no basabasa nti wakɔ hospital but ɔmo sɛ ɔnyɛ pala nti waba fie nti adeɛ kyee Tuesday ɛna ɔkɔ adwuma mu nti adwuma mu hɔ no na ɔyɛ kɔɔ na asɛ ne phone no ɛtɔɔ fam nti na ɔmo nim sɛ bi a ɔdi agorɔ nti ɔmo kɔhwɛɛ no na ɛsɛ asɛ ɔkɔ off na ɔmo de no kɔɔ hospital nti ɔmo de no kɔɔ hospital no na ɔmo de no kɔɔ emergency nti yɛde no kɔɔ emergency hɔ no na kyerɛ sɛ ɔno nso afiri mu nti yɛbisa abusuafoɔ no baeɛ na ɔmo sɛ ɔmo pɛ sɛ ɔmo hu ade korɔ a ɛku ɔmo nipa no because na ɔnyale nti doctor no sɛ ɔmo de no baeɛ no na ne ntini sɛ ɛyi na mogya no fam no asisi nti na ne ho ɛyi no mogya no nyinaa abobɔ ntimi anyɛ adwuma saa time no ɛno nti na ɔfiri mu
Okay.
Why should government halt this mandatory vaccine rollout?
Government can continue its vaccinations. We are not against vaccinations. But government should allow citizens to have enough information about the various vaccine types, their safety information, and allow citizens to make the choice whether they want to take vaccine A, vaccine B, or not take it at all. So our real concern is the mandate. Vaccinations are good. They've helped us over the years. But we don't want a situation where people feel threatened that their jobs are on the line, they cannot go to school, they cannot operate in parliament without being mandatorily vaccinated. Because the risks are there and people need to be comfortable before they take it. It's also because we have incidents of persons who've taken and had paralysis. Some have had family members pass away, and so we have somebody share their experience. And we think that every single life counts. So government should just be cautious in saying that this is mandatory. As for vaccinations, that's good, but let's not insist on compulsory vaccinations.
Right. Anything else you'd like to add? Noting that you're not heading to court.
Yes, so I believe there are about 13 institutions that we are concerned about, and mainly we are doing this because in the first instance, it was medical officers, public medical officers, who reached out to us saying that, look, we are uncomfortable. We are being told that if we don't do this, we can't work. And so there are many sectors where people are concerned. And we are just saying that government, your citizens, Mr. President, your citizens are concerned about this issue. Do some more research, connect with your own public offices and other people, and let's address their needs. Let's not run on with this course of action that might make people disaffected and frustrated because they don't think that they deserve this.
Okay, but then again, the Ghana Medical Association somewhat disagrees with your stance.
Well, yeah, the GMA. I mean, I know they wrote to the 11 doctors. What we have to say is that please take a look at the UK. At the beginning of the year, the UK indicated that by April 2022, vaccine mandates were going to be rolled along the UK. As of last week, that has been abandoned. They've had a U-turn. And the statement made by the Prime Minister is, looking at the data, we have decided to stop the vaccine mandates. We've decided to reduce the testing. And we've decided to look at natural immunity as one of the factors that will allow you to travel around without being encumbered or hindered. And so let's look at what is happening in other jurisdictions that have done even much more vaccination than ours. Look at the UK. It's a good example of what we ought to be paying attention to. We appeal to the clergy. We appeal to all right-minded citizens, to traditional rulers, that please, let's take this into consideration. Talk to your citizens. Many of them have had adverse situations and they are not comfortable. Let's encourage them. If you're comfortable, go ahead with vaccination. If you have issues, stay away from it. Nobody is forcing you, because the president himself has responded to us saying that he has not mandated vaccines. Again, the minister has not yet gone to go through the process for an executive instrument. He cannot compel anyone. Nobody in this country has the authority to force their employees or to force children or youth to be vaccinated. According to the law, it is illegal.
Mepacho conference we so jina anything like then na mo jina so the conference.
Oh, very well. Dear ma ye conference we ne say. Say ye na ye be hwa ye wo COVID-19 panie. Na panie no so e wo insunsanso bebre e de ma nipa e wo no. Ebi wo pane no ewu, ebi so ebubu, ebi so nya ohaw bebre a e de ebre omo. Eno nti na ye dwene ho se da bi etwa se ye press conference bi ete saa na ye ma oman ni hunu ene president nankasa so a ote so no efri se wedi nkan ama yate ase se pani a ye wo no embra bia entechi.
Mepacho ebi ma wo ahwe anyo mo. Nti no den na etrese omo abibi to omo na ye pane ni nti na bibi to omo.
You say ansa na nipa no bekwa kwa pane na bibi ento no. Nti the moment a nipa no bewo pane no na obenya side effect bi no ene na ebema ne hunu se pane okowoye no eno na ama no enya insunsanso bone a etisa no ena nipa bebre so na complain na pane na nkasa no kra no WHO ene company eye pane no eche se eye pane aye so ahwe efri se yare bi ba oman ni mu a enye break akra bi pe ena ye fiti preko pese ye vaccine womo ye abodie mu nhwehwemu ye nhwehwem bebre ansana ye de abetu dwase vaccine na ya ye no eye bibi papa eye ade ebebua nipa apomuden na we de ya de ebua yenkra efri se ye hwe amanhoro a etwa yen ho Asia ebiti se UK Germany Italy ne ho nkeka ho a womo wo pane ni bebre enso no one more enya COVID no kwa na ekosro ena pane ne so edi nsunsanso bone eba empo no ohwe UK kra no a saa pane we ho asem no womu hu no se eye bibia eye crime and into womu ehwehwem ekwan a efa so bae intimendi as say yen Ghana ahanomo a friend say yen ni bibia eye putupro anase emergency no aban ne hye ni pakete se onwo pane no enso nioma bebre wo horma na nka me fi se ene mom hia senka aban ne mom beye de edikan eye yi levy ohwe Ghana card ya nipa pre wo mo ho ebi kra tue ska na aye Ghana card o mamba ai ni kwan senka tue ska ndi sa nioma we ni mu ne nioma nketwa senka aban ne hwe yeni emergency biara aban ne ehwa se ode pane ne tayen so ohwe bra yare we hya se eba Ghana nipa bebre koda hospital senior na scientists ne doctors ne kan that time no na pane ne enyem bae intino doctors no di afutu bi enam abaina so eye ebai se etwa se ye ditiye na ya pomuden ho nsem no so ACP we ne nkyerɛkyerɛ ye de mai enam so na nipa bebre na omo wo ayaresabia no yeyi wo free ho no ma abra na pane ne kra ne yente ho asembia enti no hwe amama ye etwa ye ho ehia ne Ghana hanom ne ye ni bibia ye emergency ye de pane we ye kodie wo pane we ye de wo nipa ma nipa nya insunsanso boni
This year, ye ubetu kwan akwa amama bebre so a ye bisa se o COVID-19 karata e we here trese wako won se se ama o ka se ensese ye wo anase enya compulsory ye wo a na nipa ne betu kwan be de no wetu sa kwan
yo emi say o hwe sa semu ya before doctors no edi womo anu disema na se womo petition e koma aban no na embre bi e wo hosa but womo de koma aban no na aban no so de nanu disem de buy se enye ohye anase yenye ne mbra se yen wo pane bia etisa anche kra na Ghana airport eye kotokan international airport yen wiem shengina bia no womo yen hihye bi health minister yen hihye bi se se obi etu kwan na se oye Ghana ni a na se obim na se oye Ghana ni a nhihye wo honum na se ompese obewo pane ne dia ende na etwa se ye hwehwe ni nipedium ye ne test ana se ye quarantine ana se bibia etisa enti enno no aya kwenya abeda ho na me hunu se aban ne hunu se de yen doctors ne kan no eye pa enti nkakrankra na ye kasegu aban na sum ne de wiase nyina no se ne enioma eko a ebinjintum pane se enye ohye na ebinjintum ne so wan sunsanso boni e de bebre nipa no ene mpo no WHO no kra na akonfirm ko website anipa bebre na enya advert effect was pane we ya ye wo hu ndi no me fi se nkakankra na mpo no enche kra efri se sa press conference ebedru aban na sum na nipa bebre so beti as na de me ya ne se oman ni hia education efa pane we hu na ne ade aban ne edi suma nipa bebre e wo Ghana hanum efri se yenya education ni ye ya me fi se humpo hia se ye be wo pane
nti me pacho we bibi amoya na se mo bekoso akomonim bibi fufuro so ho aye nhwe kwan ana
oh adeɛ bi a no ɛm sɛ utu anamo edi kan no etwa sɛ ohu sɛ ɛde nsunsuanso papa ɛden aba na wei no deɛ yaye wei ɛne no enso ahanom a ne mmom anamo a yetu bio ne sɛ yedi nkan ɛde aban no akɔ asɛmdibea efisɛ yaka enye baako nye mienu ɛna deɛ ɛkɔso nyinaa ne so aban ne so enim a ɔnam kweti kwan bi so minim sɛ sika WHO de ma wɔn no nhyehyɛ bi tae kyerɛ anaasɛ biribi a ɛte sɛ aban no enim ɔhaw ɛde brɛ nipa na ɛnso kyenkyena a ɔhyɛ nipa sɛ ɔwɔ pane no ɛno nti no yɛfiri he ya no yɛ kokot a yɛayɛ nhyehyɛ gu na kwan mu sɛ yɛde aban ne kokot na deɛ ɛtɔ so mienu no yɛhu sɛ yɛn court wei endi mbuaya yɛkɔ international criminal court ɛno nti no ye bodewuru sɛ wiase amaman bebree international community no so bebree na wɔn so ɛfa saa ɔhaw mu wɔn so bɛka wɔn ntoma abɔ yɛn de ano na mboa biara ɛwɔ hɔ nom sɛ etwa sɛ yɛnya na yɛduru bia ɛte saa no yɛbɛyɛ nti wei ne anamo a yɛgu so a yɛtu.
AJ Royal reporting for Reeby News.